Thank you so much for joining me here at the live desk. I am Janae Hancock, and right now we are going above beyond the headlines. We'll say that it is Monday, October 2nd. So welcome to the month of October. I do want to bring in our guest for today. As you can see there, just a shocking headline. That's probably what made you click on this video, but I do want to turn things over to our guest for today. We are taking a look at Dr. Lindsay Kilgore. She is actually a breast surgeon oncologist at the KU Medical Center. And Dr. Lindsay, I want to thank you so much for joining me here at the live desk for such an important and timely conversation. How's it going?
Absolutely. Thank you for having me. Yes. October is Breast Cancer Awareness Month. And so really spreading the word is very important to me and to all of our viewers.
Yeah, and so let's speak a little bit more about that. We talk about how breast cancer, it's really rising among younger women. Do we have an age as far as younger women, and why is that?
There hasn't been a study on what specific age, but more guidelines, screening guidelines have been saying to start screening at the age of 40, whereas before guidelines had said anywhere from 40 to 50. And so we know that the incidence is rising. There's multiple things as well, though, that we're more aware of breast cancer. And so women are finding it earlier and at earlier stages, but that's also making it more treatable. And so the emphasis on early detection and then early intervention really is key. And that's why where you get your imaging is also very important so that you find it at its earlier stages.
And so I know as far as screening goes, like you mentioned, it's really just recommended for people starting at the age, women starting at the age of 40. But I just have to, know why is it not open to women who are younger than that at the age of 25 or during the ages of their 30s?
Yeah. We actually do screening imaging for women that are higher than the average risk patient. And so that's why it's important to have a true evaluation of what your personal risk is. We need to know about your family history. Do you have dense breast tissue and other things? And so we actually have a high risk breast clinic at the University of Kansas Cancer Center that can help you evaluate your risk and if you would benefit from that additional screening. We have supplemental screening MRIs at KU, as well as we have dedicated 3D mammography and supplemental ultrasound that can be helpful for patients, especially younger women, when they have dense breast tissue. And we know that dense breast tissue can be a risk factor for future breast cancers.
And so as we enter the month of October, which is Breast Cancer Awareness Month, are we seeing any alarming statistics as far as the state of Kansas or Missouri for particularly younger women?
There's not the data out there to suggest that, but we do know 1 in 8 women during their lifetime will develop a breast cancer. There's ongoing research at the younger patient populations, which we specialize at the University of Kansas. And so really being aware of your breast, your risks, ask your family members, understand your history, and then get a personal risk assessment, discuss it with your provider, or come see us at the University of Kansas so that we can help do that for you.
Alrighty, Dr. Lindsay, do you have any other advice for our viewers right now? Any young women who may be a little freaked out? Do you have any advice for them right now?
Yeah, I would just say, like I said earlier, speak with your family members, understand the cancer history that you all have in your family. And if you don't have a way of knowing that, then look at your other risk factors, such as your breast density, and limit, we always know that with any cancer, not just breast, living a healthy, well-balanced lifestyle, diet, exercise, etc., can also be contributing factors. So try to stay active, stay healthy, and understand your risks and your personal risk.
Okay, Dr. Lindsay, thank you so much for joining me here at the live desk. Of course, everyone here at KCTV5, we will continue to cover Breast Cancer Awareness Month throughout the month of October. So be sure to keep it tuned in here with KCTV5. Download our app, KCTV5 News app, and you'll have notifications right to your phone. Right now, I'm going to leave you all with a live look overlooking Arrowhead as we look ahead to our evening newscast. Thank you so much, Dr. Lindsay.